Studies show that female patients are more likely to have their symptoms dismissed by medical providers. Patients who have felt that their symptoms were inappropriately dismissed as minor or primarily psychological are using the term medical gaslighting to describe their experiences. The experience of having one's concerns dismissed by a medical provider can happen to anyone, whether it is heart disease labeled as anxiety, an autoimmune disorder attributed to depression, or ovarian cysts chalked up to normal period pain. Many women's health issues are likely to be misdiagnosed or dismissed by doctors as something less critical. So what causes medical gaslighting? Welcome to the Women's Health series, a School of Women's Health production. On this channel, we dive into the research on women's health, aiming to decrease the gender gap in research and medicine and empower women. This is episode 2 in the Women's Health series, where we explore how a wide range of disorders presents differently in women. Medical gaslighting is primarily a consequence of the gender bias in research and medicine. There is a widespread lack of knowledge on women's health conditions. Because women have historically been excluded from research trials, scientists know far less about the female body than they do about the male body, even though there are biological differences that go down to the DNA level. This means that in medical school, aspiring doctors primarily study the male body, the male development of disease, the male presentation of symptoms. Therefore, medical gaslighting is not necessarily a conscious action. It's an unfortunate consequence of a systematic problem in research and medicine. It's important to remember that most doctors are in the business of trying to help people, but they have not necessarily been trained on sex and gender differences. Another complicating factor is the environment that doctors work in, a system that does not necessarily grant the doctor enough time with their patients. Doctors are often working under difficult conditions that make it easier to make mistakes and lean on biased decisions. It would probably make a great deal of difference if doctors were given more time with their patients and saw fewer patients overall. Since it will take a while before the field of medicine has closed the gender gap, here are a couple of things you might want to consider when you feel that your health concerns are not given the attention they deserve. Preparation can be key for your doctor's visit. Firstly, it's useful to track your symptoms. This can help you and your doctor figure out the bigger picture, and it can also make it easier to advocate for yourself. After all, it's more difficult to diminish someone's concerns if you have an actual log of your symptoms. Alongside this log, it can also be helpful to prepare a list of questions and reflect on what you want to get out of your doctor's visit. What are your intentions? Are you worried about a particular condition? Are you there because you want to get blood work done? Express your concerns openly and know what you want to ask from your doctor. You might want to consider bringing a friend or relative with you to your doctor's visits. It can really make a difference if you have someone with you who can serve as an advocate and say things like, "She's not normally in this much pain." If you feel like your doctor isn't giving you adequate time or answers, you can seek a second opinion elsewhere. Sometimes it's also worthwhile to see if there are any clinics around that offer gender-specific care. There might be a clinic available that specializes in the treatment of heart disease in women, or maybe there's a special unit at the neurology department that focuses on the treatment of migraines in women. Medicine is about shared decision making. It's up to a patient and their doctor to come up with a diagnosis and treatment plan together. The relationship with your doctor is based on partnership, not paternalism. If your concerns are not addressed properly, or if you feel like you're not receiving the help you need, you're allowed to look for a doctor who does. Thank you very much for watching this video. I hope you found it informative. If you're left with any questions, please feel free to leave them in the comment section below. Have you ever experienced medical gaslighting? How did you deal with it? And do you have any tips for other women? I would love to hear about your experiences in the comment section. Stay tuned for next week's video where we will explore risk factors for postpartum depression.